went to my doctor, and you kind of have to convince your doctor to do this. I asked him to prescribe me 20 milligrams instead of 10, but still once per day for 30 days. So it's really double the dose, right? But then I cut them in half. I just go get a pill splitter from Walgreens, and you just cut them in half. It's the same price for 10 milligrams and 20 milligrams. It's just, you just cut them in half and you save half. So if you're taking a $60 drug or a $40 drug, it'll be 20 or 30 instead. So it saves you half the money. You can also do a mail order. Inside your packet, you have mail order. They'll send you, I think, a 2-month supply or 3-month supply for twice the price. Is that right? Yeah. So you can save some money there. There's all kinds of ways you can save money. You just got to know how to do it. And then you can actually do a pill splitting with a mail order. So they give you a 3-month supply, and you make it into a 6-month supply.
Nice.
So you're saving a full copay every quarter, and you're saving half on the drug. So not every pill could be split. They won't split capsules, obviously. They won't do any drugs for depression or anxiety or anything like that, because that's dangerous. I mean, if they prescribe you double the dose, you can get hurt. But I can't get hurt on Lipitor. I mean, I can take as much as I want. So we went over. So now what I want to do is go directly into the gap insurance. Remember I said you have 2 medical coverages. You have the health plan and you have the gap. Okay? The gap is one of your medical coverages. You have 2 medical coverages. Just to preface this, the gap is only for hospitals and facilities. Most of you won't even use this plan this year. If you don't go to a hospital or you don't go to a facility, you won't use it. MRI or surgery or something like that, you won't use it. Probably only 15% of the people will even use it. Okay? But when you do, it's there for you. There's 3 benefits. There is a inpatient benefit, there is a outpatient benefit, and there's an ambulance benefit. 2 ones I want to focus on are the inpatient and the outpatient. It will pay an inpatient claim or an outpatient claim. An inpatient is if you're admitted to the hospital. Basically, more than an overnight stay in the hospital. Sometimes even overnights are getting a little tough. But an inpatient stay, all maternity claims are inpatient. If you spend the night in the hospital, there's a good chance it's inpatient. Most people have outpatient claims. But let's go with the inpatient example. An average bill, because I want to go over averages. I can go over your best case scenario, I can go over your worst case scenario, but I want to go over an average, where you probably will land on a claim. An average bill for an inpatient hospital is 12 grand. All right? So 3-day stay in the hospital, average. You have, for inpatient, you have a $3,000 annual benefit. They're going to pay you $3,000 or pay the provider $3,000 for your inpatient claim. For outpatient, you have a $1,500 annual benefit. All right? On a $12,000 average bill, you owe $3,600 on a $12,000 bill. Does anybody know why you owe $3,600? What is this? Yeah. How do we get to $3,600? Yeah. Of what? 12,000. That's great. All right. So you take 12,000, subtract out the 1,500 because you have to pay that. You have to pay 1,500, right? Right here, 1,500, and then the remainder of that is 10,500. 20% of 10,500 plus the 1,500 is 3,600. Okay. So that's what you owe on a $12,000 claim. That's really good. All right. You owe $3,600. So if you didn't have the gap coverage, you would pay $3,600 on the medical plan. Okay, but you do have the gap coverage, so TransConnect Gap is going to pay you $3 grand. So you're only going to be out of pocket $600 on that claim. All right. Now it will pay you, or it will pay the hospital. There's ID cards now where you can give them, or you can just file a claim and it'll write you a check for $3 grand. Either one. Just call me and we'll work it out. I have a claims person that will take you through A to Z. Now the outpatient claims is probably where you're going to land if you get a surgery. They're doing a lot more stuff outpatient than they ever have. I mean, ear tubes, appendectomies are even outpatient now. They used to be inpatient for 3 days. Now they're just in and out. Colonoscopies, knee surgeries, shoulder surgeries. So many things are outpatient. Hernias, yeah, outpatient, yeah. So the only thing is it has to be done in a facility. It cannot be done in a doctor's office. It's got to be done in a facility in order for the gap to pay. So an average is $3,056 for an MRI and a surgery. That's an average claim for outpatient. All right, you owe $1,811. How did I get to that? Right. Say. So your deductible is $1,500. All right, on this claim. The residual of $1,500 minus $3,056 plus the 20%, right? You would owe $1,811. Again, if you didn't have the gap insurance and you only had this coverage, you would owe $1,811. But instead, this TransConnect is going to pay you $1,500, so you're only going to be out of pocket $311. All right. If you want to make an easy way to think about this, because most of your stuff is going to be outpatient, an easy way to think of this is that you have a $1,500 deductible, all right, and you have a $1,500 gap. So you really have a zero deductible plan. You just have to pay 20%. And that's really good, guys. It's very good. We set it up on purpose that way. So not having a zero deductible plan outpatient is good by me. Now, a couple things I want to share with you on the gap coverage. Number one is that the gap pays first. And that's good. Okay? A gap pays first, so if you have any small things, it'll just cover entirely. An MRI costs about $600 or $800. It'll cover the whole thing because you have a $1,500 benefit. So it'll just, you didn't get to the $1,500, so it'll pay the whole thing. All right. And also, the inpatient and outpatient benefits are separate benefits. They're separate. So if you went in and got an MRI and it was $800, it'll pay out of that $1,500. Then they send you inpatient. You get the full $3,000. Does that make sense? So really, you have a $4,500 benefit, but I don't like to think of it that way because it might not work out that way. Okay? So these are very good benefits. And then you have an ambulance benefit down here. It's only for accident. It'll pay you $350 for ambulance expenses. It's just there. It's not as good as these, I don't think. But these are all three of these are separate benefits you have access to. Again, hospital or facility coverage. Colonoscopies, got to be done in a facility. We'll cover it. Got to be done in a facility. It can't be done in a doctor's office. You know, if you get a mole removed in the doctor's office, not going to cover it. Actually, there's a $100 benefit, but I don't even want to confuse you. It's just basically not covered. All right. So, what else? Separate benefits. Oh yeah. Let's go over things that aren't covered. Because I think this is a great plan, but there's pros and cons to everything. Okay, so there's cons to this plan. It doesn't cover everything. I'm not going to sit here and tell you that this plan covers everything, because it doesn't. There's things it doesn't cover. And you need to know what they are. So you can either get around it or know what to do. It doesn't cover mental health at all. So if you go to a 30-day program, mental health, substance abuse, things like that, it won't cover it inpatient. Okay? If outpatient, it doesn't cover doctor's office visits. Okay? Well, you have co-pays, so that really doesn't matter. It doesn't cover ER for illness. It does cover ER for accident. It doesn't cover ER for illness. So if I slam my finger in this door right here and cut my finger, covered. It's an accident. If my finger hurts from the inside out, that's an illness. So if it comes from internal means, not covered under the gap. It's important to keep on remembering that everything's covered up here, just whether the gap covers it or not. Okay? Only ER for illness. You have a $125 copay plus 20%. Physical therapy, again, there's that hole in the coverage. Covered under the deductible over here, not covered under the gap. So you're pretty much paying a $1,500 deductible and 20% on physical therapy. Okay? We have a small accident benefit that will take care of some of that accident stuff, but it's a tie-in, and you have to pay for the accident coverage if you want it. All right? Labs. It doesn't cover any labs. That's why we put chemo and radiation. It doesn't cover any labs. And we have a cancer benefit that will cover this. Observation. This has been one that we need to talk about. If you are pregnant and you go to the hospital and have false labor and they just observe you and say you're not having a baby, go home, not covered. You have to be inpatient. They have to admit you to the hospital, and they didn't admit you. Okay? Prescriptions. You have copays, so that doesn't matter. And And finally, durable medical equipment. Syringes, needles, diabetic test strips, crutches, wheels, chairs, any appliances, prosthetic feet, anything that's durable medical equipment it doesn't cover. Again, it'll always be covered under your deductible, not covered under the gap. So I would say, out of those things, probably 90 to 95% of the stuff's going to be covered. But you got to know what's not covered, because not everything's covered. And if you're aware of it, you can plan accordingly. Okay? Do we see anything? Okay. So now that we're done with the medical plan and the gap, let's go back to the enrollment worksheet and see how much it costs. The deductions haven't changed since last year, like we talked about. A medical deduction with the gap, gap's all included in it, is $37.35. These are 24 paychecks. Did I explain yet that you have 26 paychecks, but you're only being deducted for 24 of them? Did I ever explain that? Okay. You have 26 paychecks that you're going to get throughout the calendar year. However, you're only going to be deducted 24 of them. So you actually get 2 free paychecks a year. Okay? $37.35 for an employee. Employee and spouse, $106.11. Employee and child or children, doesn't matter how many children you have, is $90.15. And employee family is $157.13. Okay? And if you want to waive the coverage, I want you to circle either waive or one of these. Something has to be circled here. Either the waive or a number. And if you waive, put a W in the far right-hand box, or a 0. If you put a circled number, put that number in the far right-hand box where it says per check. Okay. Let's move on to dental. That is the most complicated we're going to talk about today. Everything else is pretty easy. Dental insurance. Back to the blue sheet, as promised. Through Guardian now, dental insurance. The website is guardiananytime.com. The things I need to teach you about are you weren't used to going in network to a dentist with your old dental plan. You didn't really have any network providers. You know, like the Anthem doctors, this has Guardian dentists. Okay? The website looks like this, just to kind of show you, just because you're not familiar with it. Guardiananytime.com looks like this. Click Find a Provider, and that's where you find your dentist. Okay? And that's it. If you want to see what the Anthem website looks like, this is what the Anthem, this is how you find doctors. Get in Anthem, find a doctor. Okay? But again, here's Guardian again. Up on top, find a provider. Okay? Pretty simple. Okay. Now I stress that. Here's your website, and then you got to click PPO network. For that, here's the network. Here's the non-network. Network means you go to this website, okay, and you get a much better deal. You guys aren't used to that right now. You just go to any dentist you want. I would say, if I had to guess, there's a lot of Guardian dentists in Nevada, but if I had to guess, maybe about 30% of you, 25 or 30% of you will have to switch dentists if you want to do this in network. And that's okay. I mean, you guys are all like wanting to get to the website to see if your dentist is in there. But if it's not, if your dentist is not in there, my suggestion is to ask somebody else if their dentist is good. Just go to them. A referral is always the best way to go. If somebody's had a good experience with somebody, teeth cleanings, fillings, whatever, crowns, just go to them. Dentist office, there's a lot of good ones. There's a dentist just as good as yours. You just got to find who they are. So Guardian Anytime to find all the dentists. For that, you can get an annual benefit of per calendar year of $1,500. You had $1,000 before, so we gave you more money per calendar year. Okay. Annual deductible is Class 2 and Class 3 services. That's what an annual deductible charges you is for Class 2 and Class 3 services. You'll see in a moment. It's a $50 deductible. Okay. That was $25, so we actually upped that a little bit. 3 times for family. So that means employee has a deductible, spouse deductible, child deductible, and then no more deductibles. It's, again, important to note that a deductible is not a copay. A deductible is one time throughout the year. So if you get 6 fillings, 1 deductible. If you have to go back and get 6 more, you already paid it. Just 1 deductible per calendar year. All right. exams, cleanings, and x-rays.